Hey, this is Dr. Jen. Thanks for tuning in to learn everything about sexual and reproductive health. Welcome to Doom Scroll. Hey, Tess, what's going on?
Not a lot. I have a very big topic I want to talk to you about today. Just diving right in. Can we talk about the over-the-counter approval process for birth control?
Yes.
Cool.
So you mean the Opill, what's going on with the over-the-counter contraceptive?
Right. And this is just the progesterone only, right? It's not like the combination one.
That is correct. And there's been a lot of news out there about this. So yeah, let's talk about it.
And it's, again, the low dose form.
Correct. So it's the quote unquote mini pill that people are used to. Yeah.
Okay, cool. So theoretically, on the lower side effect spectrum, but still taking it regularly is effective at preventing pregnancy.
Right. So the progestin-only mini pill essentially will thicken that cervical mucus to prevent pregnancy. And it can prevent ovulation as well, but because it's such a low dose, it doesn't necessarily do that consistently, but it can also happen with this pill.
So from what I most recently heard was that it was advised by the FDA to make it over the counter. Is that the right understanding? And what does that mean?
I'm so happy that you asked this because I was super confused about this too. And I had to read about how this process goes down. So I should say this mini pill, as we know, is around already. This was approved back in the 1970s, but as a prescription pill, which is how we use it now. So just for folks to understand, the controversy now is that they want to make this over the counter, so without a prescription. And that's been what's been going on right now. So the FDA, before they approve a prescription like this to go over the counter, they have advisory boards that come in that's comprised of a whole bunch of experts and companies, et cetera. And they vote on safety, efficacy, and all sorts of things related to these pills. And so where we are right now is that they had two advisory panels, and in a unanimous vote, they voted to make the mini pill over the counter. Now, what happens is the FDA has to either accept this recommendation or veto it. And that's where we are right now. And we're hoping they'll have a decision made by sometime end of this summer.
Why does it take so long? Like, why are we waiting now? Like, why, if the advisory board said yes, what's this waiting period?
I don't really know exactly what happens other than it's government and everything moves slowly. I can say that for a fact. I worked for the government for a very long time. But no, I think to be fair, they want to make sure that this is safe. They want to make sure that this is effective and then it actually is going to help our patients, and not cause any harm. So some of the things, for example, that came up that I read while they were having the advisory panels were, well, are women going to be able to understand the instructions on how to take it? And some of the, conversation around that was it's really not very different as them getting a prescription for it. They still have to take it consistently. There was a concern about, well, what if they skip the pill? Again, over 15% of women who take contraceptions forget to take their pill, right? Yeah. So those were some of the discussions that were going on. The FDA now has to take all of those things into considerations and make their own decision as to how comfortable they feel, assuming the risk that a prescription like this would be over the counter.
I know you have to go. Maybe we'll keep talking about this. Who knows what's going to happen this summer, but I appreciate you clarifying some of these points, especially in your context of having experience in the government.
So this is great news for what will hopefully become the first over-the-counter contraceptive method in America, and I'm super excited about it.
Fingers crossed. Yeah. All right. We'll chat soon.
Thank you, Tess. Chat soon.
Thanks, Jen.